Welcome to the Functional and Integrative Medicine Podcast. This podcast is all about exploring root cause medicine, showcasing the power of this approach, and inspiring other medical providers to follow this incredible path. I'm your host, Ginger Allen, and founder of Your Medical Liaison, a medical marketing agency working with medical providers since 2012. My passion for root cause medicine and provider advocacy drives me to help medical providers who have incorporated functional and integrative medicine into their practices. So let's dive in. To welcome Dr. Sudha Kumar, who is a board-certified physician with over 30 years of experience, who's been delivering compassionate, patient-centered care. Her deep roots in both Western and Eastern medicine, Dr. Kumar blends modern science with integrative approaches to help patients prevent disease and reclaim their health naturally. She is also a graduate of the University of Arizona's Center of Integrative Medicine and the Bioidentical Hormone Replacement Training Academy. In addition to her medical expertise, Dr. Kumar is a certified yoga instructor with over 500 hours of training, and she has been leading yoga classes for nearly a decade. Dr. Kumar takes a system-based approach, detective-like care, and studying lifestyle habits, lab work, hormone imbalances, and nutrition to uncover the root causes of illness. She creates personalized health roadmaps that incorporate diet, movement, hormone balance, and natural supplementation, all while minimizing the need for prescription medications. A published author and wellness advocate, Dr. Kumar is passionate about empowering her patients to live vibrant, healthy lives. Outside the clinic, she enjoys hiking, yoga, and creating healthy recipes, and frequently travels overseas on medical missions to provide free care to underserved communities. It's my pleasure to welcome you to the podcast, Dr. Kumar.
Thank you, Ginger, for having me.
And thank you for giving back, to those underserved communities. I'm a big philanthropist myself, and I know how much joy that work brings. So that's really, really cool. All right. Well, I'm super excited because you have been a physician for a long time. And I remember, before we get into my regular questions, I remember talking to you at one of the meetings when I met you and talking about going out to the other MDs and DOs in the community and letting them know about what you do. And I vividly remember you telling me that a lot of these doctors really don't resonate or want to discuss or believe in integrative and functional medicine. And I clearly remember my response to you. And I said, Dr. Kumar, how long have you been a physician for? And you said 30 years. And I said, you've been a physician probably longer than some of these guys have been alive, let alone practicing medicine. And for somebody with your tenure to say, you know what, integrative medicine and functional medicine is important and it should be included in all medical practices, coming from you is a testament. So thank you so much for taking the time to be on the podcast today. So let's dive into the questions. Can you share, kind of give us your personal journey into functional and integrative medicine, brief overview of your training and your path you chose?
So I practiced Western medicine for 30 years. I was an intensivist. I was a neonatologist, if that makes
Wow.
your mind boggle. It gives me a little bit of a perspective. Why am I here? And I remember I used to have these tiny, tiny sick babies that were very sick, and the mothers that they really cared for their babies. And what broke my heart was, number one, they were on so many medications that would have adverse effect on the babies because they were sick themselves. And the second thing is, nobody talked to them about how they're feeling and why that baby had to be coming early or what the baby was sick. And third, the most important thing is they were sitting there passionately pumping their breasts to breastfeed this baby and eating Doritos. And I knew there was something wrong with this picture. And the more I, thought about it, the more I got pulled towards integrative functional medicine and then, of course, bioidentical hormones. And I told myself, acute care, people can do it. Acute care is great in this country, but what this country needs is preventative care. If we can keep the people out of neonatal intensive care unit or adult intensive care unit, I think that would be the way to do medicine in this country.
Yes, and the argument is, if we got everybody well, then there would be no need for doctors, which I don't agree. I think that preventative medicine is gonna prevent a lot of the chronic diseases, but you're always gonna need your doctor. We're always gonna need doctors, and I think that that's a scarcity mindset that we really need to stop saying.
Absolutely, I totally agree with you.
Yeah, what is your take on that? I mean, this the saying that people say, "Oh, well, the insurance companies and the, big pharma and, big corporate medicine, they wanna keep people sick, um, because there also would be no need for doctors." What is your take on that? Like, where do you think that comes from? Is it just money?
So, I think it's a very convoluted answer. I think as medical caregivers, we have the best of the intentions. We want people to get well. I think the bigger picture here is, why do people end up being where they are? And I think with the kind of lifestyle we have, the kind of stress factors we deal with, and all the toxins that we are exposed to, we end up being in a situation where we don't know why do we have the dysfunction of the body. For insurance companies to cover preventative care, it's time consuming, and it's expensive in a way because they'll need to train the doctors, number one. Number two, they're functional labs, which are a little bit more, expensive, or they're not covered by insurance company. And I think the third biggest, and this is my opinion only, one of the big factors is that the majority of the care in this country is driven by insurance companies. And
Right.
in in their interest, the only way they're going to make a profit is that if they can put somebody on statins for life, if they can put somebody on metformin or GLP-1s for a longer period of time, that's how they're going to make money. They're not going to make money if I can take 5 or 6 different supplements, which majority of the people are taking anyway on their own,
Right.
and correct my lifestyle and my metabolism. Then basically I'm just doing maintenance care for myself. So that's not profitable for the insurance company.
Yeah, I've always argued that, on the back end of that, if you look at Medicare, or the biggest insurers in the country, if we're preventing chronic disease on the back end, they would save millions and millions of dollars, if people in their, 60s, 70s, 80s, and 90s really weren't needing, all of these services that chronic disease, causes. But yes, that's the long game, and the insurance companies need to figure it out. But I do think that they were to really look at the numbers long term, I think preventative medicine would actually make them more money. But we could talk about that all day long. Let's dive into your journey. So let's talk about what are the most common root causes that you see in your patient population, and how do you address them?
So some of the root cause of the problems are, one of the things that I am very passionate about is the lifestyle. We tend to be more, we're not very active. What we put in our system is what we become. And the stress factor. People are running all day long, not understanding that the stress can be a big inflammatory factor in causing a disease. The second thing is, when you put something, I was always brought up thinking that, or my father would always say, you become what you eat. When you put stuff in your system that does not agree with your system, you can have major dysbiosis of your gut. Your digestive system doesn't work very well, and you accumulate toxins. Because if your liver is not going to detox stuff very well, you're going to start accumulating toxins. So to me, in my opinion, those are the two big factors. The lifestyle, the toxins, and also the diet in your system. The third and the biggest thing, which was the aha moment for me, was as we age, it's the hormones. There is a great deal of hormonal imbalance. And that can be, in a big part, related also to the toxin accumulation, as well as the dysbiosis and stuff like that. And as you age, your hormones are going to decline, or you're going to have imbalance anyway, but that's all expedited if you end up having a lot of toxins in your body. So for me, it's a four-pillar approach. It's your gut health, it's the detox, it's your environmental factors, lifestyle, and the hormones. So if we can get all of them to talk to each other in a very friendly manner, then you can prevent a good deal of chronic disease.
I love that. And, I've learned from doing this podcast, I used to always think that hormones was about women and, menopausal women like, or perimenopausal women like myself, but it's not. The hormone health is about men and women at all ages. And I think that we are really missing that boat a lot in the healthcare system. So thank you for bringing that to our attention. And also, the thing that I love that I think you might have been one of the first people to share so far on the show, which I'd like you to talk a little bit more, is lifestyle. I have one of my doctors, mention it when, one of her patients, had a very imbalanced lifestyle. But let's talk about that. So how do you, what labs, what diagnostic tools are you doing, like an intake form that asks them about their lifestyle? Like, how are you uncovering that whole person? How are you diagnosing that?
It's a very good question, because when I started this journey, I was at a loss to I'm like, what is lifestyle? If you actually look at the lifestyle, it's a whole gamut of things, and for some people, there are certain things that are more significant than the others. So the lifestyle would be, what kind of foods are you shopping for? Are you eating organic? Because there are certain foods that have to be, you should be eating organic. What is the source of your dairy? What's the source of your meat that you're consuming? Nuts, and then there's a whole bunch of the list of. So what are you putting in your system? Number one. Number two is the stress factor. And I was a neonatologist in my past life, worked nights, weekends, didn't sleep for the last 30 years. I mean, my sleep
On
was
call all the time.
horrible, horrible sleep. And what I realized was, because of the stress, and I was pretty good about what I was putting into my system. But what I did not realize was, going through perimenopause and menopause, through my hormones completely off balance. And my doctors did not address it. Uh, there was no conversation of replacing any of those hormones. And what I ended up doing, I was gaining weight. My mid belly fat was getting bigger and bigger. What did I do? I started running marathons. I started doing cardio like nobody else's business. And what I didn't realize was that was throwing my cortisol off. This that's the kind of stress I'm talking about. So when I see my clients today, I always look at very intensely, what is the activity level. Some of them are not moving at all, and some of them are moving too much. So once we get their hormone panel done, and we look at their micronutrient deficiencies, and we look at their gut microbiome, we can make a very accurate assessment, saying this is what you should be doing, this is what you should not be doing. So it's a very individualized approach when it comes to stress factor. And last but not the least is, I was surprised when I was doing my integrative and functional medicine. The American Gastroenterology Association, they talk about uh, constipation, the definition of constipation as having less than a stool per week. And for us, it's 2 to 3 times. You should be having a bowel movement 2 to 3 times a day. I'm sorry. And that's how I grew up when I grew up in Ayurveda in India. And it just when I see my clients, if they are not having a bowel movement, that's a big emphasis in my practice. We are
Sure.
detoxing them. We're telling them you need to get rid of stuff. If you don't get rid of stuff, I can give you whatever I want, but it's if you're not going to get rid of the waste, it's going to be a waste of everybody's time. So I think it's all interrelated with stress. There's a lot of intermingling with the hormones and what you put in your diet. So it's not only one factor, Ginger. It's so many of these things that interplay with each other, and for some people certain things might be more important than other.
Well, I love what you shared about how you were this physician, this high performing physician that was in a very acute setting where your, cortisol level must have been on high all the time. And then, your answer to your issues that you were having was go out and do a bunch of cardio. So your cortisol levels just must have been shooting through the roof when you figured out that you needed to look at your cortisol.
Oh, I actually exhausted my adrenals.
Oh
So
my
I ended
gosh.
up high, and by the time I got my diurnal salivary test, I had bottomed out. I was in adrenal fatigue, and that's another reason why I started developing insulin resistance, and my belly fat wasn't going away. So
Oh my gosh.
and I had major thyroid dysfunction. So talk about stress causing that. And on the top of that, I was going through perimenopause, menopause. My hormones were completely out of whack.
So did that help you into this journey? Is that what made you kind of be like, let's, after looking at yourself and trying to getting yourself back to health? I mean, walk me through how that went.
So I was still I was still studying integrative and functional medicine, and I went to my regular doctor. My hemoglobin A1C was going up. My bad cholesterol was going up. I had this mid belly fat. I was not overweight, but
Right.
fat was in the wrong place. So I asked my doctor. She says, "Oh, it's just age, and eventually we'll put you on metformin and this and that." I said, "What? I don't have history in the family history of diabetes." No, everybody gets a type 2 diabetes when they are your age. Went through the hormonal model, and I got my whole testing done. I got my hormone testing done, my cortisol testing done, my thyroid testing done, and the insulin. And once I had that whole picture in front of me, I started correcting each one of them with micronutrients and hormone replacement therapy. And Ginger, I have to tell you this, I have not slept in 30 years like I sleep today, because my sleeping pattern was so bizarre. And the moment I started myself on, I balanced my hormones, my sleep is so much better. And once my sleep got better, my cortisol got better.
Of course.
And not only that, once I started correcting my micronutrient deficiencies, my thyroid was happy. And with, supplementing with progesterone, my thyroid was happy. My doctor told me my TSH was high, and she said, "Oh, we'll wait for 6 months and we'll put you on thyroid medication at that time." I said, "No." I got I did all the additional testing for thyroid, put myself on thyroid micronutrients, and today my TSH is back to normal. And my doctor called me the other day. She said, "What are you taking that your thyroid got so much better?" My antibodies are down because I became gluten free, dairy free, because I ran some more testing. What kind of food should I be eating? Got my food sensitivity testing, and it told me no gluten, no dairy. Stopped all of that. And today I'm a happy camper. No more sniffles, no more asthma, because I was supposed to be on asthma medications. No asthma, no reflux. And once I got better, I was like, there is something to be said about this approach of medicine.
And when did you start your integrative medicine practice?
So my I started last year in March,
Okay.
but I think the biggest improvement in my practice happened when I did bioidentical replacement therapy, because I think that was a big piece, because most of my clients are perimenopausal, menopausal, and I am so surprised that none of their physicians have had any conversation with them about hormone replacement therapy. It's shocking to me that even in this day and age, these perimenopausal women, they're losing. I have a woman only 1 year out of she's 1 year out of her last menstrual period. She's already osteopenic. And it just shocks me that people are not paying attention to something like this.
Yeah, and I'm gonna go a little bit off my normal trajectory here. We usually talk about the business side of the practice and all of that, but we've talked about that enough on this podcast. And what I love about you, Dr. Kumar, is your depth of knowledge. You're not just somebody that finished med school, got their functional and integrative medicine license and fellowship, and started practicing medicine. You're a physician with 30 years of experience, and you went through these challenges yourself personally. So what I'd love to dive into, because I think this will be interesting for the audience, is let's talk about the science of this medicine, because I think there's a real misunderstanding in the medical community. We know for a fact that the med schools are not teaching nutrition, for example. We know for a fact that about the hormones at the level that they need to know. We know for a fact that the med schools are not teaching about all the different panels, the labs that need to be tested and things of that nature. And I remember Dr. Billstrom saying that, and he's an MD as well, that I've worked with for 5 years. I remember him saying that functional and integrative medicine is the most scientific medicine. And I thought that was so interesting, because I think even doctors don't understand that. So I'd love for you, because of your knowledge and your experience and so many years of tenure, to kind of explain to our audience, why is functional and integrative medicine more science-based than traditional medicine?
So this is a very interesting question that you're asking. When I was transitioning from my neonatal career to functional and integrative medicine, I was scared. I was like, I have never seen an adult. What am I doing in this adult world, right? But the thought occurred to me, the physiology is the same. The body works the same way, whether it's a neonatal baby or it's an 80-year-old. The physiology of the body does not. Now, it may change in certain way. The metabolism changes in certain ways, but the way the body works is the same. You put food in your stomach, the nutrients are absorbed if your digestive system is working very well. The waste is gotten rid of, and your body, when the body absorbs these nutrients, it gets to your mitochondria. If everything is working very well, it's a powerhouse. It gives you energy, and you're a happy camper, because when things are working very well, it's like body is a very smart, well-oiled machine if you give it the proper fuel. So to answer your question, so let's talk about science a little bit. When I was going through this whole thing, and when I started reading about functional testing, my brain went on fire, because we did biochemistry in med school, but nobody paid emphasis on real time, that this is what this reaction means in the real world. For example, there is a reaction in the mitochondrial world. We talk about at the end, where the energy is made. To have that last part where the energy is made, you need multiple micronutrients. So, the thought process is that, you just kind of think that mitochondria works on its own. It needs all these micronutrients, which I found out when I did my functional testing, that despite the fact that I take lots of vitamin B12 and this and that, my B12 level totally sucked. And I'm like, how is that even possible? It's because I wasn't producing enough acid in my stomach. And if you don't produce enough acid in your stomach, you're not going to absorb the B12 very well. You're not going to absorb I was anemic. I was like, what the heck? I eat so many greens, and I do.
And you're probably a vegetarian because you're Indian.
Well,
You're a very healthy eater.
I'm a very healthy eater, but I was very cognizant of the fact I'm a vegetarian primarily, but I'm very, very careful about my iron intake.
Okay.
But my point is that I wasn't absorbing those things very well. And then when I started correcting all of that, my hemoglobin went up, my ferritin level went up. So my point is that there is a real science to all of this. If your system, if your first of all, if your digestive system doesn't work very well, it's a problem. Whether you're talking about acid production, if you're talking about pancreatic enzyme production, and not only that, if your gut microbiome is totally messed up, you are not going to absorb those nutrients very well. Then talk about intestinal permeability. If you have the mucus member, the cells are not tightly knit, you're going to start absorbing toxins, and that's what was happening to me. My oxidant levels were very, very high, and so once I started correcting my permeability there, things started getting better and better. I had more energy. So, we talk about this being less scientific. We haven't done studies because people don't, I mean, these are very subjective things, because what may be good for you may not be good for me. What kind of testing you need may be very different from my testing. So if we cannot, it's so when I was in traditional medicine, for example, there is a client that comes in, you run a battery of tests on them, and then you decide. But that's not how functional medicine works. If you come to me, I have to decide what are the kind of tests Ginger needs, and then I would run those specific tests. And once I know where the dysfunction is, and when I correct that, then you start feeling better and better. So, in my opinion, there is more science to all of this, and I see this every single day with my clients when they start getting better.
That's awesome. And, that's why I started this podcast, because I really want to bring this knowledge to other MDs, DOs, and providers, because I think you're like a testament, in my opinion, to when you see a physician with 30 years working in neonatal care and saying, you know what, this is the future. This is what I want to be doing. This is, and then embracing it, and then totally changing your career path. It's just inspirational. And I can tell that you love what you do. I mean, I can tell that you're happier, you're healthier. And that's what I see a lot, on this show, is just the happiness that these medical providers are enjoying, just helping patients so much. So thank you for sharing that. And what is some of the trends? I know there's a lot of trends right now in functional and integrative medicine. What are some of the trends you're most excited about?
Oh, one of the biggest things that I am so passionate about now is these women coming with insomnia. They haven't slept. They wake up, they stare at the ceiling in the middle of the night, and they go into their doctors, they're putting them on sleeping pills, yada, 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 yada. And, you know, I, I cannot tell you how many times I've heard this. I don't know what you did, but I'm sleeping like a baby. It's one of the biggest challenges that these women have. The second thing is the unwanted weight gain in these women. So to me, I have become more and more passionate about perimenopausal and menopausal women, where they are not heard. The women, their doctors are not listening to them when
Right.
they're explaining their symptoms. With not only the hormone part of it, but their gut is messed up because their hormones are messed up. Because think about estrogen. You have the most estrogen receptors in your gut and the brain. So if you're going to be estrogen deficient, you can do whatever, you can take zillions of probiotics, but that gut is not going to be fixed unless you fix the receptors of estrogen in the gut.
I didn't even know there was such. Well, I'm a layman, but I didn't even know there was receptors in the gut. That's interesting.
Yes, and so there is receptors in the gut and the brain, and the brain fog is another one. I
Oh, I've heard
remember,
about that a lot.
yeah, and I remember when neonatology, I don't yell
I
at.
think it happened. Brain fog happened to me today because when I went to the gym, I left my car door open and I came back and I was like, what happened? just
Yeah.
left my car door open.
Well, that's another thing I see. A lot of women dropping out of workforce because they can't function very well. I mean, think about it this way. We have more women now in the perimenopausal and the menopausal years that are in executive positions in corporate life.
Yeah.
And for them to drop off the work because they can't handle that stress anymore, it's a big deal for the
Yeah.
family and for the company. So what few things that I see is digestive issues in these women that can be fixed very easily with digestive support, whatever they need, and balancing their hormones. And once we take care of those two, everything sort of falls in place, because then they want to move, or they'll go for a yoga class, or they would go for some kind of mind and body workout,
Yeah.
because now they have the motivation and say, I'm actually feeling better, I'm feeling a little bit more relaxed, so I can do this. So to me, I have become more and more passionate about really listening to these perimenopausal and menopausal women.
I love that. If there's one message that you would like listeners to take away about functional and integrative medicine, what would it be?
I always tell people, body is a very smart machine, and you are the person who can run that machine once you understand your body very well. And that's possible.
I
That's
love it.
possible.
And then please tell us where you're located and how patients, if they're looking for your services, can find you. And also if other providers, physicians would like to reach out to you, what's the best way to reach you?
So I practice in Virginia.
Okay.
My website is Holistic Health MD. I can certainly email it to you. And
HolisticHealthMD.com.
yes,
That's a great domain name.
so holistic is WHO, holistichealthmd.com. So
Okay.
that's my website, and they can book a discovery call from there or send me an email, and I'll be happy to, talk to them.
I love that. I love the play on holistic.
Mhm.
That's a cute twist that you did there. Well, thank you so much for being on the show. And again, I just love having, physicians with tenure on the show to really, I think, legitimize, right? I'm looking to legitimize this for other providers. And I think you brought a lot of legitimacy to the podcast today. So thank you very much for taking the time out of your clinic to be with us today.
Thank you so much, Ginger, for talking to me, and you do such good work. Thank
Oh,
you.
thank you.